Pancreatic cancer is one of the quietest killers in modern medicine. Not because it's especially rare, but because almost every early sign it produces looks exactly like something else in digestion. A pulled muscle, getting older, a rough week. That overlap is the entire reason this disease so often gets caught only after it's already had time to spread. Today, I'm walking you through 8 signs your body can send out long before this becomes dangerous. And one of them, symptom 6, almost never makes it onto lists like this. Even though doctors who specialize in this disease see it constantly in the patients sitting in front of them. Stay through all 8, because in the end, it's not any single symptom that matters most. It's the pattern they form together. Before we get into the list, I want you to understand something about why this particular cancer is so hard to catch early, especially past 50. The pancreas sits deep in your abdomen, tucked behind your stomach and close to your spine. It's not an organ your doctor can feel during a normal physical exam. It doesn't show up clearly on routine blood work the way, say, elevated cholesterol or blood sugar might. And it doesn't cause pain the way a more surface-level problem would, at least not at first. That's not a failure of your doctor's attention. That's simply geography. The pancreas is built in a way that hides trouble, until trouble has already had time to grow. Which means, in practice, the earliest warning system most people actually have access to isn't a scan or a lab test. It's their own body. If they know what signals are worth paying attention to, and which ones are worth mentioning out loud instead of quietly explaining away. Let's go through it, one at a time. Number 1, urine that suddenly turns dark. This is one that almost everyone brushes off as simple dehydration. You notice your urine has turned a noticeably darker shade, sometimes described as looking like tea or cola, and the instinct is to drink more water and move on. Here's what's actually happening physiologically, and why that instinct doesn't always solve the problem. The pancreas sits directly beside your bile duct, the tube responsible for carrying a substance called bilirubin out of your liver and into your digestive tract. When a tumor develops in the head of the pancreas, the section closest to that duct can press against it and partially or fully block it. Bilirubin that would normally leave your body through digestion instead backs up into your bloodstream, and your kidneys attempt to compensate by filtering some of the excess out through your urine, which is what causes the darker color. The detail that actually matters here isn't the color itself, it's the pattern. Drinking more water might lighten things for a day, maybe 2. But if the underlying blockage hasn't gone anywhere, the darkness returns. Simple dehydration resolves cleanly once you rehydrate. A mechanical blockage doesn't care how much water you drink. If you've noticed your urine cycling between normal and dark for more than roughly 2 weeks, regardless of how hydrated you are, that's a detail worth bringing up at your next appointment, specifically, not something to keep monitoring quietly on your own for another month. Number 2, abdominal pain that's already been given the wrong name. Chances are, if you've experienced this one, a doctor has already looked at it and called it something else: arthritis, a pulled muscle, acid reflux, or simply getting older. And in most cases, that assessment is probably correct. But here's how pain related to the pancreas tends to present differently, so you can tell the difference in your own body. It typically starts as a dull, persistent ache located in the upper abdomen, just below the breastbone, sometimes shifting slightly to the left. Unlike a strained muscle, this pain often doesn't stay localized. It can radiate around the torso and settle into the middle of the back, which is why some patients describe the sensation as a belt or band slowly tightening around their midsection. The reason for this radiating quality has to do with anatomy. The pancreas sits surrounded by a dense network of nerves, and as a tumor grows or presses against surrounding tissue, Those nerves can transmit pain signals well beyond the original site. There are three specific details that tend to separate this from ordinary musculoskeletal back pain. First, it often worsens noticeably within 30 to 60 minutes after eating a meal. Second, it frequently intensifies when lying flat, which is why some people find themselves unconsciously sleeping, propped up on extra pillows, or in a recliner, without fully understanding why. Third, it tends not to respond meaningfully to the usual remedies, heating pads, over-the-counter anti-inflammatories, rest the way a strained muscle typically would. If this specific combination sounds familiar, it's worth describing it to your doctor in exactly those terms. Upper abdominal pain that radiates to the back, worsens after eating, and worsens lying flat. That level of specificity is often what prompts a doctor to consider imaging rather than simply treating it as a musculoskeletal issue. Number 3, losing your appetite after just a few bites. This one tends to show up quietly, at the dinner table over weeks or months. You sit down to a normal-sized meal, get through a few bites, and feel unexpectedly full. The common explanation people reach for is simply that their appetite has changed with age. Sometimes that's exactly what's happening. But there's a mechanical explanation worth knowing about, too. The stomach sits directly in front of the pancreas. As a tumor grows, it can physically press against the back of the stomach, effectively reducing how much food it can comfortably hold at one time. On top of that, a pancreatic tumor can interfere with the release of digestive enzymes the pancreas normally produces, meaning food you do eat may sit in your stomach undigested for longer than usual, which keeps the sensation of fullness going even after a small amount of food. The result, over time, tends to be unintentional weight loss. And this is worth taking seriously regardless of the underlying cause. Losing more than roughly 5% of your body weight over 2 to 3 months without changing your diet or activity level is considered a significant warning sign across many areas of medicine, not just this one. If you've noticed you're eating less without trying to, and the number on the scale has moved down noticeably as a result, that's a detail worth raising directly with your doctor rather than filing away as a minor lifestyle shift. Before we move to the fourth symptom, I want to say something plainly. Across cases involving more advanced diagnoses, there's one sign that tends to show up again and again, and it's also the one people are most reluctant to bring up out loud. I'll walk through it later in this list. But the next few symptoms help explain exactly why this particular cancer is so easy to misread in the first place. Number 4, jaundice, and the itching that often comes with it. Jaundice is what happens when bilirubin has backed up in the bloodstream long enough that it begins depositing in tissue throughout the body. The most visible signs are a yellowish tint to the skin and to the whites of the eyes, in people with darker skin tones. This tends to show up most clearly in the eyes and in the palms of the hands. What's less commonly discussed is that jaundice is often accompanied by intense, widespread itching with no rash, no obvious cause, and little relief from lotion or antihistamines. This happens because the bilirubin depositing in the skin irritates nerve endings directly, rather than being the result of a skin condition in the traditional sense. Here's the part that makes this particular symptom especially tricky for people over 50 specifically. Jaundice caused by gallstones looks nearly identical, same yellowing, similar itching, and gallstones are extremely common at this stage of life. That overlap is exactly where a diagnosis can get delayed. A doctor sees yellowing, reasonably suspects gallstones first given how common they are, orders initial testing accordingly, and a deeper investigation into other causes can get pushed further down the line as a result. This is why it's so valuable to present the full picture at once, rather than one symptom at a time. Dark urine, upper abdominal pain that radiates to the back, early fullness after eating, and now yellowing of the skin or eyes. Together, that combination tells a more complete story than any single piece on its own. Number 5, an unexplained blood clot. This is a symptom that catches people off guard because, on its surface, it doesn't look like it belongs anywhere near a conversation about cancer. It usually shows up as swelling in the calf or thigh, along with warmth in the area and a dull, heavy ache that doesn't improve with rest or elevating the leg. Pancreatic tumors can release substances into the bloodstream that make blood more prone to clotting than it normally would be, particularly in the deep veins of the legs. This matters for a serious reason. If part of that clot breaks loose, it can travel to the lungs. Sudden shortness of breath, sharp chest pain that worsens with breathing, and a rapid heartbeat occurring together are signs of a medical emergency. And that combination calls for immediate emergency care, not a scheduled appointment, not a wait-and-see approach. Research has consistently linked unexplained blood clots to pancreatic cancer closely enough that if you've experienced a clot with no clear explanation, no recent surgery, no long flight, nothing obvious pointing to a cause, it's entirely reasonable to ask your doctor directly whether abdominal imaging should be part of the workup. Not as a panic response, but as a responsible next step, given what's known about how these two things can be connected. Number 6, new-onset diabetes after 50, without the usual explanation. This is the symptom I mentioned earlier, the one that rarely makes it onto lists like this one, even though it shows up often in more advanced cases. If blood sugar suddenly becomes difficult to manage later in life, especially without the typical risk factors like significant weight gain, a sedentary lifestyle shift, or a family history of diabetes, that's not something to assume is simply age catching up with you. A pancreatic tumor can interfere directly with the organ's ability to regulate blood sugar, since insulin production happens in the very same organ the tumor is affecting. In a meaningful number of cases that have been studied, a new diabetes diagnosis in an older adult with no obvious cause has turned out, in hindsight, to be one of the earliest visible signs of an underlying pancreatic issue, sometimes appearing before other symptoms became noticeable at all. If you or someone close to you has recently been told your blood sugar has become unexpectedly hard to control, it's worth explicitly asking your doctor whether that new development has been fully explained or whether it's simply been treated as a standalone diagnosis. Number 7, exhaustion that doesn't match your life. This one is easy to dismiss because everyone gets tired sometimes. But there's a difference between ordinary fatigue and the kind associated with an underlying illness like this one, and it's worth learning to tell them apart. Ordinary fatigue usually has an identifiable cause, a poor night of sleep, a demanding day, extended stress, and it typically responds to rest. You sleep well, and the next day you feel noticeably better. The fatigue associated with cancer tends not to follow that pattern. You can sleep a full 8 or 9 hours and wake up feeling just as depleted as when you went to bed. Simple tasks that never used to require much thought, walking to the mailbox, carrying groceries in from the car, climbing a single flight of stairs, can start to feel disproportionately effortful. Part of the reason has to do with how cancer cells behave metabolically. They compete directly with your body's healthy cells for glucose and nutrients, which means your organs and muscles are effectively running on less fuel than they need, no matter how much you rest or how well you sleep. If you've noticed a kind of exhaustion over the past several weeks that feels heavier, more constant, and simply different in quality from ordinary tiredness and rest, isn't fixing it the way it used to that's worth mentioning to your doctor as its own distinct symptom, rather than something you're simply getting used to. Number 8, changes in your stool that are uncomfortable to talk about. This is the symptom almost nobody wants to bring up. which is exactly why it tends to go unmentioned the longest, and it's the one clinicians who specialize in this disease often say they see in nearly every advanced case they've treated. The pancreas produces enzymes specifically responsible for breaking down fat in the food you eat. When a tumor blocks the pancreatic duct, those enzymes can't reach the small intestine the way they're supposed to, which means fat passes through your digestive system largely undigested. This changes the appearance of your stool in fairly specific and recognizable ways. It can turn pale, sometimes gray or clay-colored, take on a greasy or oily appearance, float rather than sink, and carry an unusually strong odor compared to what you'd consider normal. Alongside this, some people also notice nausea, particularly after eating fatty or rich meals, occasional vomiting, and a general sense of heaviness or discomfort in the abdomen after eating. Because fat isn't being properly absorbed, the body also isn't absorbing certain vitamins that depend on fat for absorption, which can contribute to the weight loss and fatigue described earlier. If this kind of change in your stool persists for more than about 2 weeks, it's worth a direct phone call to your doctor rather than something to wait out privately, uncomfortable as it might feel to describe. Here's the most important thing to take from all 8 of these. No single symptom on this list should send you into a panic on its own. Nearly every one of them overlaps with conditions that are far more common and far less serious than pancreatic cancer dehydration, gallstones, ordinary back strain, a slower metabolism with age. What actually matters, medically speaking, is the pattern. Noticing one of these in isolation is common and usually not a reason for alarm. Noticing 2 or more together, say, upper abdominal pain radiating to the back, combined with unexplained weight loss and a new kind of fatigue that doesn't respond to rest, is a combination that deserves a direct, specific conversation with your doctor. So here's exactly what to do with this information. Write down what you've noticed. Which symptoms specifically? Roughly when it started. How often it happens, and whether it seems to be getting worse over time. Bring that list with you to your next appointment and read through it in detail rather than summarizing it as simply feeling a bit off lately. Specific, well-described symptoms tend to prompt specific investigation. Vague descriptions tend to get treated conservatively with a wait-and-see approach. And if something still feels unresolved after that conversation, it's entirely reasonable to ask directly whether imaging a CT scan or an abdominal ultrasound makes sense given everything you've described. It's worth remembering, too, that outcomes for pancreatic cancer differ substantially, depending on the stage at which it's found. Early-stage detection genuinely changes what treatment can accomplish. The single biggest factor separating those outcomes isn't luck, it's how quickly a pattern like this gets recognized and acted on, rather than quietly explained away for months at a time. If this gave you a clearer picture of something you hadn't heard laid out quite this way before, go ahead and hit like. It helps this reach someone else who might need to see it today. Subscribe if you'd like more breakdowns like this each week, the kind of health information that doesn't always make it into a routine appointment. And if there's someone in your life who's been quietly brushing off back pain, low appetite, or exhaustion as just part of getting older, send them this video tonight. It might be the nudge that finally gets them to make a phone call they've been putting off.